Hey guys, Nurse Quippy here. Welcome back to my channel. If this is the first time we're meeting, back in 2023, I was diagnosed with ovarian cancer, and my channel is dedicated to mainly talking about all things cancer. So please subscribe, hit the like button, and most importantly, please share this video with even just one person today, because you never know. The information in the videos might help somebody. All right. So today I just wanted to talk about my side effects that I personally experienced during chemotherapy. Now, I'm sure there's just so much information out there, as side effects can be a laundry list from A to Z. Basically, you can experience side effects in every system. So, neurological, cardiovascular, gastrointestinal, the skin, the integument, and the list goes on and on and on and on. But I must say that for me, I consider myself very fortunate, because I remember prior to starting my first round of chemo, I was just going crazy inside thinking, oh, I'm going to be vomiting all the time, because you see that in movies and TV shows, and everything is really dramatized. But I was certain that I was going to have nausea and vomiting, and I am so very, very grateful that I did not experience any nausea or vomiting. Okay, that's a lie. I vomited once, and it was a very small amount, and I think it was related to something else. But basically, I had one very minor episode of vomiting after, like, I don't know, round 3 or round 4, and I think it was related to something else. But so that was a side effect that I was very happy that I did not have. I know that it is common, but there are many medications out there. They call them anti-nausea, anti-emetic medications that if you're going to be starting chemotherapy soon, most likely you don't even have to ask for these medications. The doctors should prescribe them for you and just tell you that if you have nausea, to take them. But if they don't prescribe any anti-nausea medications, you should inquire about it, because you want to have them, in your bedside drawer just in case you need them. But we'll move on to one major symptom, side effect that I experience, and it's also probably the most common, or the second most common side effect that people undergoing chemotherapy will experience, and that is fatigue. So that was probably my worst side effect during chemo. Not to mention, the fatigue doesn't go away the moment that chemo ends, But yeah, fatigue. So I would have the chemo. I think my chemos were scheduled they were every 3 weeks, but they always landed on like a Tuesday or a Wednesday. I can't remember. And because they give you steroids before they administer the IV chemo, the steroids kind of linger in your system, and I would feel good at least the following day after chemo, and sometimes it would, linger to the second day after receiving chemo. But by the third day, I was starting to go, and by the fourth day, basically just throw me on the couch, leave me there, throw some food down at me. I had no energy. And because my blood pressure tends to be on the low side, I think that was also affected too. So if I would, of course, I was lying down on the couch for prolonged periods. So if you're tired and if you do that, I would advise people to, when you sit up, when you want to get up, don't just jump up from your chair, from your bed. I would sit at the edge of the couch, let my feet dangle for 2-3 minutes, because a few times I stood up fast and my blood pressure tanked and I basically almost fainted. So be careful with that. But yes, fatigue. From days, let's say 4 to days 7, 8, I mean, I would have to force myself. I knew that it was not in my best interest to lie on the couch all day. So, and I didn't want to penalize my partner by, because he didn't want to go out, he didn't want to leave me home by myself. So I knew that it was probably better for us, better for me, even if I was exhausted, to just, by day 5, day 6, get up, get in the car, go for a coffee, whatever. But fatigue was probably the most debilitating side effect I had. And, I'll tell you right now that it's pretty normal, right? Um, so, and that lingered, quite honestly. It would come and go, but I felt the effects of fatigue probably for like 3 months, 3 months after chemo ended, and there's no timeline. Like, it's not linear. I believe that it can just go up and down. My second most common side effect from chemo, and just, a little bit of a disclaimer, it's a graphic warning. It's not pleasant, but it is what it is, and that is constipation. And when I say constipation, I mean horrific constipation. I can't remember if, like, the day before chemo, I took, some laxatives or what. I really don't remember. Half of it is a blur. But after the first round of chemo, I don't think I was, anything majorly constipated, and I probably took some laxatives and whatnot, and I was okay. But then after the second round of chemo, it was terrible, terrible. And guys, ladies, let me tell you, you do not want to experience the degree of constipation that I did. Like, and again, it's graphic, but you know what? This is life and this is real. So I just want to prevent anybody from having to go through the terrible constipation that I did. So ask your doctor, for laxatives, stool softeners. If you eat prunes. But after the second round, I prepared myself for rounds 3, 4, 5, and 6. So I would take what I took was called Laxaday. Depending if you're in the United States, I don't know, maybe it goes by Miralax, whatever. The active ingredient in the laxative is called polyethylene glycol. But there's so many out there. I would suggest, and it's not medical advice, it's just what I would do to prepare myself, again, is 2 days before your chemo starts, take 1 or 2 laxatives every day to just get your bowels prepped. Because I would spend like an hour on the toilet, and you don't want to be straining, you don't want to be increasing all that pressure, especially if you have other, cardiac issues or whatever. Like, you could literally cause, straining during a bowel movement can actually cause like a cardiac arrhythmia if you're predisposed to that. It's just no fun. So I would basically be pooping little tiny pebbles at a time. I know it's not fun, but this is real, guys. It's not pleasant, but it was horrible, and I was bloated, and it took like 4 or 5 days, and I literally had to put a glove on a few times and just go inside myself and gently break a few pieces off. And I'm not recommending that you do this, but this is what I did because I was going insane. So constipation was my enemy number 1, basically, because after round 2 it was just horrible. But then I had to basically take laxatives throughout my chemotherapy. And the third most common side effect that I experienced was joint pain, and this was severe. And I knew it was a side effect of the Taxol. But by day 2, day 3, I would start to feel like these throbbing, electric joint pains in basically in all of my joints, but especially in like my wrists, my knees, my ankles, throughout the body. But like, I would get up to walk up and down the stairs, and my knees were so stiff that I really had to exercise them. So that was a big one, joint pain. And because the nature of ovarian cancer and the surgery that I had, it put me into surgical menopause, which also comes with its, joint pain is also a common in symptom of menopause. So those were the three major side effects that I experienced during chemo: fatigue, horrific constipation, and the joint pain. So what did I do for the joint pain? I didn't do that much. I would take Tylenol when it was severe, and just try to do a little bit of gentle yoga and stretching, and it did help. Honestly, the joint pain was worse when I was, more sedentary, and when I mustered up the courage to, get up and actually move. It wasn't as bad, but it was still there. So that'll be all for today, guys. So if anybody feels like sharing their chemotherapy side effects in the comments down below, I would be curious to hear. And also, I just want to shout out that this is t-shirt I'm wearing. So I am in Canada, and every year across multiple cities in Canada, we have the Walk of Hope, and that will be taking place across Canada on September 8th, Sunday, so basically in 2 days. And this is a major fundraiser event to raise awareness and honor, women that have lost their lives, and it's a really, really important day. So I'm going to be linking the organization, Ovarian Cancer Canada, down below. So I would love it if you guys could just, I don't want to ask for money. The money won't go for me. Like in the link, it goes straight to the organization. But it's super, super important that we raise money to go to research, to develop better treatments for the women out there. So, even $5 is, there's no amount too small, or even just sharing the page with somebody would be highly appreciated. All right. So I'll see you guys in the next video. Bye.